WHO has commended the Mataniko Health Care Centre for its innovative and resilient diabetes care model, praising frontline staff for delivering quality services despite limited space and resources. Andrea Mahanua reports.
World Health Organization (WHO) Regional Director for the Western Pacific region, Dr. Saya Ma'u Piukala, has praised the Mataniko Health Care Centre for its innovative and resilient approach to diabetes management. Dr. Piukala visited the health facility this morning. Despite operating with limited space and resources, healthcare workers at the center were commended for delivering high-quality diabetes and foot care services while maintaining accurate patient data. Health workers in the country, supported by the WHO, have undergone training on NCD diabetic management, and the model used is currently being rolled out across clinics in Honiara.
Despite the limited space, the limited resources, but they deliver a very good initiative on diabetic management and food care. And what impressed me most is their ability to keep the data. Despite no computers to keep their data, they keep data for informed decision. And the food care, I am very impressed that the management of diabetes, the food care, will definitely reduce the numbers of food sepsis as well as amputation. People don't realize that once you lose a limb, it affects your quality of life, it affects your productivity, and
National Referral Hospital Head of Surgical Department, Dr. Rooney Jagili, said the early phase rollout of the model shows strong potential. He noted that once fully implemented, the approach could significantly reduce the number of NCD patients requiring amputations at the National Referral Hospital.
So time this fella model of training him come for coaching as many health workers throughout the country for you may roll him out so that you can control him diabetes and NCD early, then you can reduce him now number of patients or people where undergoing diabetic food complications. So for managing and look after patients with diabetic food is so expensive as we mentioned. Patients are admitted on an average of 35 to 40 days staying in the hospital. But me believe that I think if this for a model rolled out throughout the country, that diabetes and NCDs and properly managed, people with diabetic food complications or that are early managed, I think the number of patients will come through for amputation and should reduce. So we really look forward that this for a model of where you may do him, you may try to roll him out here, it becomes standard throughout the country, and I think that's the only way where you can reduce major diabetic food complications and infection.
Central Honiara Zone Supervisor Barbara Giro said the implementation began with a strong focus on quality assurance. She added that the nurses at the Mataniko Health Clinic remain committed to reducing NCD-related complications in the country.
The start of the implementation is more on quality improvement. Without quality improvement, Bamifal still say that there is no space within our clinic. But through the quality improvement, Mifal looking that Mifal garam space, Mifal sabe creating something and innovative where him come up with all the ideas flow of nurses, Mifal come up for building this clinic where even though Mifal garam limited space, but we able to do everything that Mifal go learning law coaching. No anything him miss out now. Mifala actually practicing, and now it's become something that nurses take ownership and not proud of it, that they will continue to implement and continue to do better management.
Dr. Saya and his delegation left the country today. Andrea Mahanwa for SIBC TV.